Thank you. First of all, I'd like to say I'm absolutely delighted to participate in this panel, and thank you so much to Julia and to Thomas, who's been coordinating this session for this opportunity. For those of you who don't know that much about the Wellcome Trust, I'll just give you the sort of two-sentence summary, which is that we're a global funding charity that funds medical research and the medical humanities. And it's basically enabled to do this through the endowment of Henry Wellcome. Henry Wellcome, in many ways, like Bill Gates, was a great visionary. He passed away in 1936, and since then, the endowment has continued to grow, in particular with the growth of the Wellcome pharmaceutical business as it was then, and then its ultimate sale to Glaxo. So today, currently, that endowment stands at about £14.3 billion. And that is therefore substantial enough to generate a funding capability of £600 to £700 million per annum. So we're extremely fortunate to be in that position because being totally independent, a lot of the pressures that might prevail over venture capital and other commercial investors, and also political pressures that might prevail on other types of funding organisations, we're essentially quite immune from those. So the term patient capital applies to us, and we're very privileged to have that. And I guess one advantage that we might be able to claim over the Gates Foundation is that our founder can't walk in on you at meetings. And so I have heard it said that that might be deemed to be an advantage. So I'm going to talk really only about the Technology Transfer Division in the Wellcome Trust, which is one of the three major funding divisions, the major one being science funding, and also then there's the medical humanities and public engagement side of things. But the Technology Transfer Division is the youngest one and was created around about 8 years ago now to maximise the impact of medical research in general and to help accelerate the medical research access to the marketplace, in fact, to accelerate the development of R&D, development and R&D in general. So the key here was to make maximum use of the instrument known as program-related investment, such that as a charity, it was possible to provide grants and investment into specific programs with a view to getting a fair and equitable return for that investment. Although we focused on early stage R&D funding and funding gaps, and I do like the term pioneer funding gaps because that probably describes it very well, the decision to fund is actually motivated by public good rather than the commercial return. So that, in essence, captures our purpose. This gives you a total overview of what we've been able to achieve up till the end of last year. So roughly about 220 projects have been supported, and you can see the wide range in the amounts that were awarded to projects. So we don't cap what people can apply for, as long as it makes sense that by the end of the award, they reach a meaningful point and hopefully a commercial exit point by the end of the award. And we would want to facilitate and enable them to do so with the funding that we make available, such that the gap has been substantially closed. So over that time, over £350 million has been committed. And I'm pleased to say that I think 1.5 times that has also been leveraged from other sources. So you can see that we've had a fair number of exits through mergers and acquisitions or licensing, and products have been launched. So on the first slide I had up there, you saw a picture of a chlamydia rapid diagnostic test, and that has been followed by HIV and hepatitis B tests. And below it you saw a picture of a video laryngoscope, which is much easier to use in people who are not trained anaesthetists for intubation. So there have been success stories, but if you were to ask me what is our return on investment, it's clearly a fraction of a percent. It's tiny. So that just illustrates that our motivation to fund is the public good side. Of these projects, roughly about 45 are targeted towards developing world health needs. And the amount is roughly a third, over £100 million committed in that area. So here's an example, a slide just showing examples of the types of organisations that we've been funding for small molecule drug discovery. And you can see we fund directly into universities, we fund small biotechs, we fund institutes, and the arms of big pharma, such as the Novartis Institute for Tropical Diseases, that focus on global health needs, and so forth. So you can see there's a huge range, and the models used are also very flexible to set up the agreements for these organisations, depending on the nature of them. I wasn't going to do, in the interest of time, any specific case studies, because I think later on you're hearing from OETC, which is one of the models that we use for funding a TB vaccine development, and you may hear also about AstraZeneca India, whom we fund for TB drug discovery. So, but suffice to say, and I can answer questions on this, that we use convertible loan instruments with small companies where it makes sense, with a possibility to either recall the loan or to convert to equity. We do revenue sharing agreements where that makes sense, and we have standard terms and conditions that are available for people to see before they apply. This shows you the geographical spread of the funding from TTD. And as I mentioned, that we have a substantial number of projects that are targeting global health concerns. And although the funding may be going into the UK or West Coast US or Europe, a lot of those projects are still about global health needs. And in India in particular, there's been a lot of investment recently, such that from just within the Technology Transfer Division, we've set up a vaccine research institute that's focused on vaccine needs of resource-poor countries, and that's a joint venture with Merck. So Wellcome Trust and Merck have both put up £45 million each over 7 years to set up an R&D institute targeting vaccines for the developing world. And in addition, the Wellcome Trust is halfway through a 5-year, £30 million initiative funding R&D for affordable healthcare in India, which has now already funded 15 projects, which range from diagnostics to devices, as well as vaccines. So quite a diverse set of projects. And how do we do this? Well, essentially, what we do in the way of diligence and governance and management is no different. We've talked to other groups who fund early stage R&D, and we handle the projects in essentially the same way in terms of diligence and oversight. So I'll stop there. Thank you very much.